In this video, you'll learn how to extract 407 in a cat. This tooth has type 1 tooth resorption. You see that resorptive lesion in the furcation area. So the first thing you want to do is take a scalpel. I use a 15C scalpel because this is small enough for a cat. And you release the gingiva. So you do stabbing incisions all the way around the tooth. This is very important because once you do a stabbing incision, you are leading the way for your luxating instrument into the space between the bone and the tooth. And you want to extend the flap a little bit, just 4 or 5 millimeters rostrally. So mesial or in front of the tooth, you want to extend that incision a little bit. This is to prevent tearing of the flap and to be able to close properly. It's very important that you release the gums a little bit off of the healthy tooth also, the 408, because if not, it's going to tear in that interface between the two teeth. So I'm using a feline periosteal elevator here. This is called D2005. It's from IM3. It's very nice because it's small and it's straight and it's easy to get in here and just pry that gingiva off. It needs to be sharp. If it's not sharp, it won't work as easily. So the important thing is to keep a strong contact with the bone and then just in a twisting motion, pry that gingiva off of the bone. You want to rest your hands on the table, on the patient when you're doing this to be in complete control. I'm just going to extend this incision a little bit just to make sure that I can actually lift this part easier. This is an extraction that is often causing problems to veterinarians, especially the closure part, because it feels like there's no gums to close and it's easy to dehiss after. But I'll show you in the end of this video how to prevent it so they will never dehiss. Never say never, but you'll do your best to prevent it. So this is called an envelope flap. You notice I don't make any vertical releasing incisions. It's simply not necessary. You can do it in the beginning once you're getting used to this extraction, but once you are more experienced, then all you need is a envelope flap. It's less trauma and less suturing afterwards. So I'm using what I call a root tip burr. It's very long, 3 centimeters long. It's very thin. It's a straight burr. I use it to remove the alveolar bone. And these structures are very tiny, so I highly recommend getting a custom pair of loupes with 3.5x magnification and a good headlight, or else you won't be able to see these details. So I just make some sweeps across with this burr to remove some of that alveolar bone right here. And what you want to pay attention to is that bone-tooth interface. So you make your sweeps a little bit wider than the root, so you end up seeing the interface between the root and the bone. This is very important. Again, work on that second root, make the sweeping, and now you see once this whitish bone and the periodontal ligament is away, you see the color change. It gets slightly more yellow. That means that this is the root. And because you are making those sweeps a little bit wider than the root's diameter, you will see the tooth bone interface, and this is where you will create your grooves. And the grooves serve a purpose. That's where you insert your elevator luxator. So now I'm sectioning, so just section the tooth here. Be careful not to drill into the gingiva on the other side. You can stop just 0.5 millimeter before you exit and use your instrument to break this last piece of tooth. That's how you prevent drilling into the flap on the other side. So I'm using a very sharp luxating tool. This is from Dentonomic. They are really good for getting into that tight space. See here, it's digging into the periodontal ligand space lingually. And these instruments are so cool because they will find that spot lingually, and they will be able to push itself into the periodontal ligament space. Any winged elevator or thicker elevators will not be able to go in this exact spot and loosen the tooth. So now I just wanted to release that last part with the bone, and I go in and I gently do a little bit of elevation to move those roots a little bit away from each other. This is a way to release them. I'm using a cutting motion here. So imagine this is a strong scalpel, and you don't want to twist a scalpel, you want to cut it. That's the way you should use these instruments. This is a 1.5 millimeter, I think. So you see it's already nice and mobile. So I went ahead and tried to grab it with my extraction forceps and get it out, and oops, see, it fractured. No panic, we know where the root is and we know how to get to it, so just calmly move on to the next root, get that out, and then we'll take care of that, the other root a little bit later. See, I switched instruments here to a little bit bulkier one. This is the luxate, it's called stubby handle luxator from IM3. They are still sharp and thin, so they can cut, but they are also strong enough that you can also elevate with them. And elevation is just twisting. So use this to cut and elevate. And now you see that tooth is mobile again. So I will just work a little bit here in the furcation area. This is a spot you can also get your instrument in between that root and the bone. So slide down between the root and bone. See if you can find a good spot. Once you are found a tight spot, that's when you rotate and keep that pressure for a little bit. Now slowly, okay, now I see it's quite loose. So when you see it's moving this much, don't keep rotating, because if you keep elevating, that's when they tend to fracture. Just hold the pressure and see slight rotation. It's very important that you rotate a little bit. You may be scared to rotate because you think it's going to fracture. But once it's this loose, this is the action you often need. You need to rotate and pull. So I'm just removing this flap a little bit, holding it away with the periostal elevator, and you can clearly see the root down here. So remember, no panic, because we know it's here. Let's say we could not see this root and get to it, then I would make a vertical releasing incision mesially here, so rostrally front. But this is not necessary right now, because it's so loose that we can actually grab it from the top. Now it's very loose, so I can get it out. And you always want to do a post-op x-ray to make sure that everything is out. And you see this looks very nice. So I'm happy. Okay, here's the tricky part. This is where a lot of veterinarians are getting into problems. And it's the closure and release. Make sure that you release the lingual side. Always, always, always release the lingual side too. And release on the healthy tooth. See, this is not going to work because it's stopped. It's still attached in that space between those two teeth. So I want to go in with my scalpel blade and just cut those fibers so I can release this piece of the flap. If I just kept stretching with my periostal elevator, it would tear. That would not be good. So we want to work carefully. Press hard against the tooth and bone, and then twist hard against tooth bone, and then try to twist it off. See, now it's released on the lingual side, also here, and you want to release a little bit of that healthy root on the other tooth. Up to the furcation area, that's where you can safely release on a tooth that's not coming out, up to the furcation area. That's recommended. You can extend and it will like attach again, but it's not as strong as attachment. So you want to do that. Now you go with your football burr. So this is a medium grit diamond football burr. Use that to smooth any sharp edges down, and you can take the whole level of the bone a little bit down, just 2 millimeters down. This means it gets even easier to close the flap. See what I'm doing here? I'm actually trimming the inside of this flap. I'm trimming that granulation tissue off to aid with the healing, to make it better healing. And you can use a diamond burr to do that. Don't try to use a round burr or a tapered fissure straight burr, because you will absolutely destroy that flap. But a diamond burr is very nice for also trimming the granulation tissue and the epithelium off of the inside. Now I'm just stretching this part. So go a little bit deep, 1 centimeter down, and stretch. See how I did here? I'm stretching this tissue, and now you have a wonderful flap that has absolutely no tension. The only thing needing to do now, the only thing left, is to trim those serrated edges. You see those edges are not nice and straight. You want to have a fresh edge to suture to each other. That will heal much better. And for that I'm using a curved Lagrange scissor. Those are very nice with serrated edges, and they don't tend to slip when you try to cut. They will actually dig into that flap, even though this is a very tiny flap, and actually cut. So important to invest in a good pair of scissors here. See? No tension at all. So I'm taking the bites now for suturing. Make sure you take 3 millimeter bites, so 3 millimeters thick and 3 millimeters apart. That's the rule of thumb. I'm using a purple dyed monocryl suture, not a PDS, a purple dyed monocryl. Not all countries have them purple dyed, but if you can get them in a color, it's much easier to see because this is very, very small. But if you have dental loops, you will have no problem seeing anything. You can see all that you want. So making the surgeon's knot and 2 throws above that. Double, 1, 2, 3, actually 3 throws, and you want to tighten it. The last kind of throw, you want to tighten it, make sure the knot is not coming undone. Have a look at the knot, and if it's already opening in the last round here, and then you want to either tighten it more or replace it. Go 3 millimeters away, take 3 millimeter bites. This is a reverse cutting needle. I like those a lot. They are very easy to get through the gingiva. Double throw. 1, 2. Make sure you don't get any whiskers in there. 3, 4. So you can do a little extra throws. That's okay. If you have stomatitis cases, you want to either bury the knots or do continued, because you don't want to have them collect plaque while it heals. But for this cat, it's okay. You don't need to do any special suturing techniques, just simple interrupted. And it's a 5-0 suture. Sometimes you have to do in 2 steps. That's okay. Make sure that you enter and exit in a 90-degree angle into this flap. Grab a good, nice, big bite. And this will not dehisce. So that's how I avoid getting these dehiscence when you only have to remove the first premolar. If you want to watch another video where I extract 307 and 308 in a cat the same manner, then just click this video up here and go to the next one.